Hello again. Today we're going to talk about another interesting topic, which are seeing now in Kuwait in rise, and this topic is going to be around about the inflammatory bowel disease, what we call it Crohn's disease, mainly Crohn's disease. There is also ulcerative colitis and Crohn's disease. They are interchangeably, and we'll talk to them both together, but I will concentrate in the Crohn. So what's inflammatory bowel disease? This is inflammation of the bowel, and the exact cause of this inflammation is still not known, but there is multiple factors can aggravate or can cause this kind of thing, but still the exact cause of this disease has not been known yet. So the patient with the Crohn's disease usually present with abdominal pain, diarrhea, and weight loss, and sometimes bleeding by rectum, and sometimes abdominal distension and bowel obstruction. So the symptoms usually depend on the Crohn's. Ulcerative colitis is different, which is interchangeably with the Crohn's, but ulcerative colitis is only affecting the colon, which can present with bleeding by rectum. This is the main thing, the main presentation. So the Crohn's patients usually have these kind of symptoms, and usually also some of them they present mainly with disease around the anal canal or anus. So they will have fistula or fissure or abscesses around the anus. So this is what other presentation of Crohn's. Also, so what's the etiology? There is a genetic factor. The family who has known to have Crohn's, usually there's a genetic influence. Also, the patient who smokes, we know that the smoker is an influential factor for Crohn's disease. Also, the patients who are not eating healthy and most of the time eating junk food and eating fat saturated food, and who is not eating a lot of vegetables or fruits or fibers, and this is so there's some association as well. Of course, the environmental factors also there is and the additive in the food is also a factor for this kind of type of disease. So this is an additive factor. We usually ask the patient to eliminate this factor to help to treat Crohn's. Now, how we diagnose Crohn's? So then, if with a patient we suspect the patient has a Crohn's disease, which is inflammatory bowel disease that affecting the colon and the small bowel and the upper GI. So it affects from the mouth to the anus. This is a Crohn's disease, can affect any part of this GI system. Ulcerative colitis usually affect mainly the colon and a small part of the small bowel, but Crohn's disease, which is the inflammatory bowel disease, affect the whole GI systems. Now, so if you suspect Crohn's, now the next step that we have to do a physical exam just to make sure that the patient has no other stigmata for Crohn's disease, because the Crohn's disease can affect the joint, can affect the skin, can affect the spine, the orthopedics, and can affect the nerves. So that we have to make sure that the patient's being examined properly. Then we have to do the blood test. The blood test we do usually routine blood test to make sure that the patient has not anemic, and we have to check his renal function and we have to check his liver function test. Then after the blood test we have to do colonoscopy. Colonoscopy is the main diagnostic tool we use, where we can take a biopsy. We can diagnose if there is a stricture, we can diagnose if there is a mass, we can diagnose the inflammation and the severity of the inflammation. This all can be done by the colonoscopy. Colonoscopy can go all the way to the small bowel, and the upper endoscopy also crucial. We can do the upper GI endoscopy where we can see the esophagus, the stomach, and the duodenum. So this is the investigation we can use, and then we're going to go ahead to the other investigation, which would include CT scan. The CT scan is very also important to diagnose Crohn's disease and to help you for the treatment. And also there is another tool we can use. We call it MR entography. MR entography, this is a very good test where we can give us a good idea about the whole entire GI system, and also give us an idea about the Crohn's disease, the severity of the Crohn's disease, the type of the Crohn's disease in a way that is this a structure is inflammation or fibrotic. It will help us in the treatment where we can see how long of the bowel is available, especially if the patient has surgery before. So this is briefly, now we talked about the Crohn's disease and how we diagnose it. Now in the next, after the break in the next session, we're going to talk about the treatment of Crohn's disease. Welcome back. So the treatment, what treatment we can do for Crohn's disease after the diagnosis? So if we do the diagnosis, we diagnose the patient with Crohn's disease. Now the treatment. The treatment usually happens first. We start with medical treatment. Before the medical treatment, there is a new test we use. We call it stool calprotectin. This is to help us in monitoring the patient treatment and also help us the diagnosis, and it helps us after establishing the diagnosis and treating the patient. So after establishing the diagnosis and we started the treatment, we usually start with the medical treatment. There is a vast type of treatment we can use, and usually the treatment of IBD, we refer this patient to the IBD specialist, or our gastroenterologist usually treat the patients. Now, if the patient has a failure of the medical treatment, or the patient has presented with acute surgical problem of Crohn's, which include bowel obstruction, bowel perforation, severe malnutrition, bleeding per rectum, or if the patient has abscess or fistula inside the abdomen between the bowel and the colon, or fistula between the bowel and other organs, or fistula between the bowel and the skin because of this abscess, then we intervene surgically and emergently. This is regarding emergency. But if failure of the medical treatment, then this is a planned surgery, and usually we treat it surgically also through the laparoscopy. Laparoscopy now is very advanced. We use multiple modality, multiple equipment to help us to treat Crohn's disease, which is inflammatory bowel disease, through the laparoscope. Through the laparoscope, we're going to resect the disease part, which is going to be the most common type is going to be in the right side and the end of the small bowel. This done laparoscopically through the keyhole surgery, or it can be done open. We don't prefer open anymore. Also, we can do it through a single port surgery. We can do a resection of the part of the colon. Also, if there is any other strictures or any abscess, we're going to clean it. We clean the abdomen from the abscess and the pus, and also treat fistulas between the small bowel or the large bowel to the other organs, such as to the bladder, or to the vagina in the female, or the uterus, or to the skin. So we can this also treated laparoscopically. After treatment through the laparoscope, then the patient will require medical treatment as well to prevent a recurrence. Now, if the patient has multiple Crohn's disease, multiple site of the small bowel affected, we can do what we call the structuroplasty, where we can repair or widen the structure through a procedure called structuroplasty. Now, we can also remove the entire colon through the laparoscope. We can do ileal pouch as well through the laparoscope, and also robotic is good. So this is briefly about Crohn's disease. We talked about the inflammatory bowel disease, mainly Crohn's, which is affecting the GI system from the top to the bottom. The patient presents usually with abdominal pain and loss of appetite, weight loss. Investigation need to be done is the stool calprotectin, blood test, colonoscopy, and CT scan or MR angiography. Then the treatment modality is either a failure of the medical treatment or the patient presented with acute surgical problem due to Crohn's disease. We intervene surgically either through the laparoscope or open. Our preference now to do laparoscopy, and we can resect the colon and the affected part through the laparoscopy or even a single port surgery, and the patient usually return to his normal activity quicker and faster if we do the laparoscopic approach. Thank you very much.